Then now it's my pleasure to welcome Dr. Artyushenko from Art Photonics, Berlin, and we look forward to your presentation, Dr. Artyushenko. Thank you so much for being with us.
Thank you. Just to make communication easy, my formal name is Vyacheslav, but easy name for friends and partners is Slava. So much easier to pronounce for the future. First of all, thanks to IWAM and COMPAMED, for the invitation to present our results. And I did not put all the others because it's not only results which I have reached myself, it's a whole team results. And I would like to be focused on how to say fiber solutions, because we are a fiber optic company. And Art Photonics is a company since '98 in Berlin, when we really develop fibers for very broad range. And let me change the slide. Okay. So, but maybe before fibers, I will tell you that why cancer. Cancer is one of very important application area, very important for the whole humanity, because as you know, cancer is how to say, statistically the second killer. And we really decided after years doing cables for laser medicine, we decided to be focused on diagnostics, because you see one diagram over here that trend overall on the market is really when the treatment was major part of medicine in 2007. Now we are in 25, and that was prognosis, forecast. I don't know how precise that was, but you see that diagnostics is really, treatment is really much smaller portion, but diagnostics was really growing. And that's why we decided to be really more focused with biophotonics method and with our fiber optic solutions to diagnostics, because to make a proper, how to say, excision of cancer, even by surgery methods, it's very important to know where is the margin of cancer. And we decided something like 10 years ago to be focused on method how to distinguish malignant tissue from normal tissue. Again, why cancer? Because it's not only second killer, it's very, how to say, sophisticated and complicated enemy. And cancer of different organs is really specific for the mortality and how to say, lifetime after detection. Everybody knows that it's better, of course, to detect it as early as possible. And there are some cancer types which are very frequent. For the men, it's prostate. For women, it's breast. And it's really, even the statistics, from, let's say, 10 years ago, it was already like 4 seconds. Each 4 seconds, we are losing one person on this planet. So that's why question how to find methods of diagnostics and proper treatment, it was kind of our wish. And as soon we are fiber optic guys, and we can really change, how to say, common technology, how spectroscopy normally used in laboratories. Somebody should take a sample, prepare the sample, bring it to sample chamber, and measure characteristics. Fiber optics gives a chance to make touch sensors, flexible, just to touch tissue. And for example, even to distinguish, is it, for example, normal tissue? Of course, for a single cell, it's difficult, but when it starts to grow, we can really detect different spectral parameters of cancer, malignant cells compared to the normal cells, and define where is the border of the cancer. And if you are looking for this kind, again, it's not our results, just copy and paste this kind of interesting prognosis that we are at the edge between 2030, that optical molecular spectroscopy starts to be kind of a regular tool for diagnostics of cancer, different type of cancer. while our body is complicated bioreactor, I should say, with very different components, with very different spectra. Question to find biomarkers. What is specific for cancer and what is unusual, just to distinguish normal and malignant tissue. Back to our capacity, possibilities. We really use different fibers. So we use silica fibers, which are from UV up to near-infrared. We have partners, supplying us infrared glass fibers. To be honest, my baby, it's a very unusual polycrystalline silver halide fibers with one unique feature. This fiber is very flexible. You see this kind of picture. We can make a knot, and it's not fragile because a lot of infrared glass fibers are really brittle. More of it, some of them are toxic, or like chalcogenide fibers. Fluoride glass fibers are brittle and a bit hygroscopic. Polycrystalline silver halide fiber is very flexible. It can be used for up to 150 degrees, which is important for industry. But we decided to use any kind of fiber optic tools and find the way how to distinguish malignant tissue and normal tissue, while for the fibers, we are probably only single manufacturer of these fibers in the world, and we are capable to cover the whole very broad range from UV up, let's say, from 250 nanometers up to 16 microns. That's why any method of spectroscopy we can really convert in fiber optic coupled spectrometer. And we developed for years, because company is, as I said, it's already 26 years old. We developed different probes, including tiny probes for cancer. Of course, for medical probes, you must fulfill demands for, let's say, medical applications. Small diameter, highly flexible, biocompatible, sterilizable, what else? Even tiny enough to be used through the instrumental channel of endoscopes. And I must simply put only, just because of time pressure, I would like only to mention in one slide what can be done for cancer diagnostics using unique feature of polycrystalline fibers. You remember Corona time, when everybody was forced, to measure temperature by infrared imaging camera, all right? Because at room temperature, at least around 300 Kelvin, maximum of emissivity is about 10 microns over here. This is exactly the range where polycrystalline fiber is transparent. So it means we are able to make infrared endoscopes which can be used to detect cancer inside human body, because flexible PIR fiber can go inside. And we have one very interesting project, not for cancer, but it was the very first infrared endoscope developed together with a company, Securus, which was and is a daughter company of, let's say, okay, jump from my mind, doesn't matter. In general, they try to see temperature growth during the treatment on heart. It was radio frequency ablation catheter used inside heart, but FDA forbids these operations because this catheter must overheat a group of nerves which simply bring wrong signal to the heart for the shrinking. So that's why catheter was moving up and down, plus minus 3 centimeter. This kind of small, tiny mirror was rotating, and then you can make an infrared video. I have no video in this moment, but in general, we can see how the warm spot is growing on tissue. And we can detect where exactly, and stop overheating in proper moment, because it shouldn't be, how to say, RFA barbecue. It should be, let's say, maximum 45 or what else degrees Celsius. But infrared endoscopes can be used for cancer detection. There is one company in Israel, HT Bioimaging, who already use it because normally cancer in active phase is a bit warmer, plus 0.2, 0.3, up to half a degree warmer than normal tissue. And in result, you can detect it, just by imaging, infrared imaging, even inside body. Can be, of course, solutions when it's many fibers, just to make kind of infrared endoscopes. But to make a lot of pixels, it's a bit too expensive solution. But rotating version and moving version, which can be used inside instrumental channel of endoscopes, it's really a solution which is economic and can be used in the future. But this, sorry guys, it was interrupted connection, and I'll be back with my presentation. Sorry.
Okay, no worries. Please go ahead.
Okay, from here. So again, idea how we shall use any method of spectroscopy was based on the very simple, how to say, French rule that this liberté, égalité, and fraternité. All methods, they have their pro and contra. That's why mid-infrared absorption, where you can easily see different organic molecules. Raman is progressing. Yes, many years ago, more than 15, it was already, let's say, this statistics, mostly mid-infrared, a bit Raman, but Raman right now, it's really fast progressing. Near-infrared, what is not mentioned here, because it's not vibration, it's fluorescence. And we decided to use any method, including infrared, of course. Infrared is our favorite. We started. And what you see on this slide now, it's one of the oldest spectra we measured just by touch of the fiber to the skin. So, and you can see, for example, skin cancer, the skin spectra, which is different. Depends if you really wash your hands with a soap, if you put sunscreen cream on it, or you see how fast, especially in this area, any lotion is going through the skin. And this kind of approach, because fiber optic here, it's a bare fiber, and when you touch to the skin, part of the radiation goes through the fiber to the skin, penetrates for, let's say, 5 microns, and then you can really measure absorption. It's so-called attenuated total reflection. And that's why here it's water, there are lipids, there are some other organic molecules which are really can tell you, what kind of composition. And our very good friends and colleagues from Tel Aviv University, you see a picture here of Professor Abraham Katzer. They try to detect 3 types of, how to say, problems on the skin. So-called basal cell carcinoma, squamous cell carcinoma, and so-called BCC and SCC. And of course, to distinguish them from some other problems which are not so, how to say, aggressive, not so dangerous, and so on. Same type, you can see maybe piece of fiber over here. In difference with the classic method, when dermatologists are looking with a, how to say, lens to see the picture of melanoma, you see how specific are spectra for melanoma, for BCC, and for squamous cell carcinoma. So it's not yet the method, which is established, because here it was only 90 patients tested, for the clinical studies. But I think it's a great perspective for the future. When we started, we also used our infrared fibers first to detect, for example, cancer. It was in vitro or ex vivo in the past. And we also noted very big difference for malignant tissue and normal tissue. Then after PSA, after treatment of the spectra, you can really distinguish tumor from normal tissue. You can do it in near-infrared. It's not as clear, but nevertheless, you can also distinguish, let's say, cancer and normal tissue. That's why our project named FOMOS fiber optic molecular sensor was based on 4 methods of spectroscopy, when we can really use different spectrometers: FTIR, Raman spectrometer, near-infrared, fluorescence. We even put all of them on the wheels, to move it close to the surgery room to measure difference between malignant tissue and normal tissue. So method was really, how to say, multispectral. And with this kind of approach, we did a good job with a company, not with a company, huge hospital city, Charité in Berlin, with our good partners at Erasmus Medical Center in Rotterdam. And you see what happens when we really use different method. So fluorescence, yes, you can really distinguish by separate method some difference, but quite often you have overlap. When you fuse the data from mid-infrared absorption and fluorescence, you can really reduce dramatically, let's say, mistakes, which are so-called negative or positive false detection. So we started from the in vitro samples of kidney tumor. We even developed some kind of simple prototype of the software which will tell to the doctor normal or tumor based on this kind of spectroscopy. Later, we tried different combination. We started from mid-infrared absorption and fluorescence. Then later we did near-infrared and fluorescence. And also, let's say, versions when it was near-infrared and mid-infrared together. We found at least one specific biomarker for cancer of renal cell carcinoma, glucose. Of course, as cancer needs fuel, it sucks glucose from the body, and that's why it's one of the biomarker. When we did a very interesting project named Rashua with the company Riverdi and Erasmus Medical Center in Rotterdam, later on, we are still working with University of Antwerp, then it's another biomarker. When you measure with a Raman probe only lipids and water, then more or less most often it looks like that, this green stuff. So intensity ratio for water over here, and this is lipids. But when it's too much water, and that was for the cases of oral cell carcinoma, so squamous cell carcinoma, then we can detect, where is the border, where is the margins of tumor. And we did it with extremely tiny probe. This probe is only 160 micron in diameter. It's a single metal-coated fiber with a special shape of the tip, which can go inside excised piece of tissue with a speed of 1 centimeter per second. And every 100 milliseconds, we can distinguish either it's malignant or normal. So then we can make a, 3D shaping of the margins using this kind of method. It's high wave number Raman spectroscopy. So right now, it's not only in Rotterdam, in Antwerp, it's even used for endoscopic application. So plan is to go from ex vivo to in vivo application soon. Again, same stuff to show. That's why for the normal tissue, lipids can be in this ratio with water, but for the cancer, it's much higher. And when we go with the needle at different angles to the piece of, let's say, tissue, which is excised, ex vivo, then we can detect shape of the tumor and help to the doctor remove it completely, but same time by minimal invasive way. So later, just to keep my schedule, I simply can show that we already maybe pioneering the world with the combi sensors. When we put under this kind of, let's say, small diamond or cubic zirconia cone, we can combine mid-infrared and fluorescence because there are two couples of fiber, infrared fiber and silica fiber. And in result, we can really differentiate tissues. It was not for cancer, it was simply for the model, using only two wavelengths, because we started from mid-infrared spectra, but unfortunately, you see what happens after treatment of spectra. We can see one organ, but question was how to distinguish liver, breast, and fat. And it was two other organs overlapped. Fluorescence, another organ was easy to see, but the others were overlapped. But when we did data fusion, we were able to make good differentiation of all three tissues. That's why this method can be also used for cancer detection. And the most interesting is that you don't need very expensive equipment. We used only one wavelength in mid-infrared and one wavelength for fluorescence to have a very good separation, a very good differentiation of different tissues. So this is the new idea. Plus our latest publication last year in Nature Scientific and Nature Portfolio, when we combined in the same probe, we combined Raman and mid-infrared. So as you know, it's complementary information about vibrations of molecules, and we were capable to do from the same area, from the same spot, to collect Raman spectra and mid-infrared, which is really, again, helps to enhance accuracy, precision of detection. Just to conclude that from the complicated measurements with spectrometers, we decided to move to the sensors. And we, for example, replaced spectrometer for near-infrared, which costs 15 to 20,000. We replaced by very simple sensor, which was created, designed only for moisture detection, that it can be 4 LED, two of them for absorption bands of water in near-infrared and two for reference. In result, we also tried it later for detection of prostate cancer. It will be next slide. There is one other solutions from company Multispectra, but I'm really afraid to be out of my, dedicated time. And I hope that Ivan COMPAMED will deliver these slides to everybody, and if somebody has questions, we are ready to answer. But again, about this sensor we developed based on only 4 LED. Yes, you can use a spectrometer. You will see spectra, but in general, you can replace it, but only 4 LED. And we selected, of course, this LED with a well-developed, let's say, chemometric model. And here you can see, for example, difference for the kidney renal cell carcinoma. This is cancer, only 4 wavelengths, or normal tissue. Okay, it's not always perfect. Here they are too close to each other, but nevertheless, it's a very interesting idea because sensor itself is really low cost, portable, and more of it. Each sensor has IP address. So that's why you can really collect data in cloud, and then you can really get it even when you are a good doctor but sits other side of the planet. You can control your colleague doing the operation in Singapore, and sitting in Berlin. So you can help him to find the dangerous areas on the tissue, not to miss any kind of traces of cancer. So that's why I think where we are looking, what I'm dreaming of, that we shall develop sensors which will be used like Internet of Things. So it will be spectral fiber sensors made like Internet of Things sensor. And it can be LED, but can be, of course, more exotic sources. So what you see here, it's quantum cascade lasers. And we have excellent project with our partners in Ulm. It was 14 partners. It was a project name Miracle, well funded. But it was for one disease, how to see so-called osteoarthritis in cartilage. So to distinguish, let's say, diseased area from normal area. So that's why with fiber optics, you can put we did it up to 7 quantum cascade lasers collected in one fiber. And then this fiber with a catheter can go inside knee and measure it in, let's say, in real time, in situ, in vivo. So final spectra, for example, looks like that. This kind of green lines, it was our selection for the wavelengths of quantum cascade lasers. And we collect all these 7 wavelengths inside this box. Then it was simply a catheter which goes inside the knee to detect, let's say, normal cartilage and diseased area. So just to conclude, I think that fiber optics can help really to distinguish well malignant tissue and normal tissue. And starting from research, it can be resulted for each specific cancer in a sensor, which will cost, let's say, only few thousand, not tens of thousands, with relatively simple software, which will give you, how to say, either red lamp, red light, or green light, or it will be even like beep beep, beep beep, you know, when you park in your car. Beep beep normal and beep beep beep, it's cancer, you know. So acoustic signal to the ears of surgeon to help him to make, how to say, very precise, minimal invasive, but complete resection of cancer. So, and just to mention at the very end of my presentation that I just collected some interesting prognosis, forecasts, you know, that cancer biomarker market is really expected up to 42 billion in 29, with a fast growth, more than 11%. Molecular diagnostic market is also estimated like 32 billions, you know, in 29, even with a faster growth. So molecular diagnostics is coming to medicine. Plus, of course, it can be also bioliquids. It can be blood, serum, which is used for the screening even before the cancer is detected where it is. It can be already used, and there are a couple of companies in Glasgow, in France, in Rennes, who are really doing this liquid biopsy market for screening and tissue diagnostic market in general, you know, not only for cancer, but it's progressing. So that's why here I would like to say, sorry for some interruption because of, let's say, connection broken, but again, to show the team with whom we did it, you know, at Art Photonics. And now latest news that last year we were acquired by company Nynomic, and we joined the group of companies, 12 companies under the umbrella of Nynomic. And we are very open for partnership, for very interesting work for cancer diagnostics.
Thank you so much for this inspiring talk. So the implementation of non or minimally invasive live detection is truly fascinating. And I mean live detection in a double sense, so in real time and in the living being. So thank you so much for this inspiring presentation. So thank you, Sarai, for your question. This presentation was interesting because it highlights the potential to diagnose patients effectively without highly invasive or blood marker testing. So I would really like to hear about any regulatory considerations they have about this. How accurate is the diagnosis, etc.?
Yeah, it's very good question, but I should
Sarai's
say,
question.
Yeah. When we started from laser intervention, when it was laser catheters, then you need a, let's say, more complicated, sophisticated, and expensive and long-term procedure to get FDA or what else approval for that. Diagnostics is a bit more easy because you do not cut anything, you do not make intervention, but you simply suck information. But it means only that your instruments must be sterilized, must be biocompatible, but it can really help doctor not to... today, I was really shocked when we started. Every surgeon doing the resection of cancer should collect by biopsy some samples and send it to histopathologist. How many samples you can do during the operation? You have a limited time, and you could not predict that cancer, let's say, cancer is not a ball. Cancer named cancer, or let's say crabs, because of, let's say, this shape. If you have only one finger missed, then, it can be again cancer growing in this place, and all the methods like chemotherapy, like radiotherapy, it's a damage for the body. You can kill immune system. What else? So that's why to find, how to say, precise tools, how to detect margins of cancer and remove cancer completely, but not doing it, let's say, 3 times bigger. When we started, it was some doctors bring us, colon cancer, 3 kilo on the table. Please define the margin. Margin were really for 100 grams. But they don't care, they simply cut much more just for safety. So, okay, you can do it for colon. We have 30 meters or what else, more than 10 meters of colon. How you will do it for a tongue? How you will do it for brain cancer, where small mistakes means a lot. So that's why it's a lot of work to do here, but I think we are open the way to very interesting. I see great light at the end of the tunnel, but certification, you're right, it's important. We need partners, medical partners for it.
Thank you so much, Sarah, also for the excellent question. So Antonia has another question. Are these PIR fibers compatible with FS pulsed lasers?
A very good question, because very short pulse of laser is difficult to deliver, because it will be elongation of the pulse during its way through the fiber. There are some kind of possibilities, but then it should be very unique fiber, so-called photonic crystals. Or negative curvature fibers, where the even short piece of fiber, I don't know, 1 meter, 1.5 meter, will not elongate it too much. But I really recommend that we can really discuss this very interesting topic after this, let's say, discussion, because I can tell you something like half an hour about different options. But today, classic silica fiber or classic infrared fibers will not give a chance for femtosecond pulse to be delivered into the fiber, not a problem. Question that to have no damage. But at the output, it will be not femtosecond. It will be much longer pulse. So that's why we should respect some kind of rules of optics, because it's difficult to argue with Mother Nature, and we should simply look how to use this femtosecond technologies, but to be honest, it's at very early stage for the application with fiber optics. Without fiber optics for melanoma may be easy, because you can reach it without problems. But to go inside human body endoscopically, it's a problem. To be discussed, maybe subject for joint projects.
Thank you so much for these insights into truly need-driven innovation. Thank you so much. Oh, there's another. Antonia is writing. Thank you, Dr. Artyushenko.
Yeah. Thank you all for attending. And again, as I remember, these slides will be available for everybody. So that's why, in general, and we are very open for the new ideas, for questions to answer. And believe me, there are more questions not to answer immediately. So then we should really work together, to get answers.
Thank you so much. We really appreciate your collaborative approach. Thank you so much.
Thank you. Thank you.